A vaccine for coronavirus could be at least a year away, but the government seems to be trying to engineer the same effect with something called herd immunity. The expectation is that enough people will become infected with the virus that they develop immunity. This would stop it spreading widely and protect the vulnerable. Here's an example. We know that each person who catches the virus is likely to pass it to between 2.4 and 3 others. But if enough people develop immunity, then transmission is reduced considerably because there are fewer susceptible people. But how many is enough depends on how contagious a disease is. As this chart shows, measles is very infectious. One person can pass it on to 12 others. And so for herd immunity to work, around 90% need to be immune. But coronavirus reproduces at a far slower rate, so successful containment requires just 60% of people to have been infected and developed resistance. Now, taking the UK as a whole, that's around 40 million people catching COVID-19. The available evidence suggests 32 million, or 80% of them, would have mild symptoms. But that means around 8 million could have severe or critical symptoms and would need treatment in hospital. The government expects 50% of those severe cases to be in hospital during the peak of the outbreak, which is expected to last around 3 weeks. And that would put considerable strain on the NHS. But of course, that assumes you haven't isolated the most vulnerable people, and that could be crucial.
Each death is a death too much, and each person who has to be admitted in intensive care occupies a bed that may be essential to save lives for someone who has a stroke or heart failure or what have you. So I don't think we can let nature go, its game.
Scientists also have no idea how long it would take for 60% of the population to become infected. That number simply hasn't been reached in any other country.
In terms of building up a herd immunity within the UK, what sort of percentage of people need to have contracted the virus?
Probably about 60% or so.
60%?
60% is the sort of figure you need to get herd immunity.
Even with that, even looking at the best case scenario, half of 1% to 1% fatality in something like this, that's an awful lot of people dying in this country.
There'll be tremendous repercussions. There will be a tremendous death from that. Death. You're talking about death. Probably more death from that than anything that we're talking about with respect to the virus.
Okay, that 15 days.
In order for their health service to cope. What is herd immunity? Because it's caused a lot of people to panic just from hearing that term. What does it mean?
When there are enough people in the population who've had the infection, then one infectious person who's producing virus, that virus just keeps coming to people who are immune, and so the virus dies out, it has nowhere to go. And the questions really, and we don't have the answer to this at the moment, how many people need to be immune for that to start to happen, depends on how infectious the virus is, how long the immune response lasts, and how efficient it is. And we have no idea about those parameters at the moment.